Emphysema is a chronic, progressive lung disease that is part of a group of conditions collectively known as chronic obstructive pulmonary disease, COPD. It primarily affects the alveoli, the tiny air sacs in the lungs where oxygen and carbon dioxide are exchanged. Over time, emphysema causes damage to the walls of the alveoli, leading to shortness of breath and reduced oxygen exchange. This disease is most commonly caused by long-term exposure to airborne irritants, especially cigarette smoke, and has no known cure, although treatments can help manage symptoms and slow progression. Causes and risk factors. The most significant cause of emphysema is smoking. Tobacco smoke damages the lung tissues and accelerates the breakdown of alveolar walls. The longer and heavier a person smokes, the greater the risk of developing emphysema. Other causes and risk factors include air pollution and environmental toxins. Long-term exposure to industrial dust, chemical fumes, and air pollution increases the risk. Genetics. A rare inherited condition called alpha-1 antitrypsin deficiency can lead to emphysema even in non-smokers. This condition affects the body's ability to protect the lungs from enzyme damage. Age. Most people with emphysema are over 40 years old at the time of diagnosis. Occupational exposure. Jobs involving dust or chemical exposure, example mining, construction, increase vulnerability. Pathophysiology. Emphysema causes irreversible damage to the alveolar walls. Normally, alveoli are elastic and expand with air during inhalation and contract to expel air during exhalation. In emphysema, the walls between the alveoli are destroyed, resulting in fewer, larger, and less elastic air sacs. This reduces the surface area available for gas exchange, making it harder for oxygen to enter the bloodstream and for carbon dioxide to leave the lungs. As the disease progresses, air becomes trapped in the lungs, making breathing difficult. This trapped air leads to overinflation of the lungs, a condition often seen on imaging tests as hyperinflated lungs. Over time, the diaphragm may flatten and become less efficient, further impairing respiratory function. Symptoms. Symptoms of emphysema usually develop gradually and worsen over time. They include shortness of breath, especially during physical activity and eventually even at rest. Chronic cough. Wheezing. Fatigue. Reduced exercise capacity. Chest tightness. Weight loss, in advanced stages. Barrel-shaped chest, due to lung overinflation. Unlike asthma, the symptoms of emphysema are typically not reversible with bronchodilators, although some medications may help ease them. Diagnosis. Emphysema is diagnosed through a combination of medical history, physical examination, and diagnostic tests. Pulmonary function tests, PFTs, measure how well the lungs are working, especially forced expiratory volume, FEV1, and forced vital capacity, FVC. Chest X-ray or CT scan reveals overinflated lungs, flattened diaphragm, and damaged alveoli. Arterial blood gas analysis measures oxygen and carbon dioxide levels in the blood. Alpha-1 antitrypsin testing, conducted if a genetic cause is suspected. Treatment. While emphysema cannot be cured, treatment focuses on relieving symptoms, improving quality of life, and slowing disease progression. Options include medications. Bronchodilators help open airways and reduce breathlessness. Corticosteroids reduce airway inflammation. Antibiotics used if infections like pneumonia or bronchitis occur. Oxygen therapy for patients with low oxygen levels. Supplemental oxygen helps maintain oxygenation and prevent complications. Pulmonary rehabilitation, a structured program involving exercise training, nutritional advice, and education. Surgery. Lung volume reduction surgery, LVRS, removes damaged lung tissue to improve lung efficiency. Bulectomy removes large air spaces, bulli, that interfere with breathing. Lung transplant, considered for severe cases when other treatments fail. Lifestyle changes. Smoking cessation is the single most effective step to slow disease progression. Avoiding environmental pollutants and staying updated with vaccinations, flu, pneumonia, is also crucial. Complications. Emphysema can lead to several serious health complications. Respiratory failure, pneumothorax, collapsed lung, pulmonary hypertension, cor pulmonale, right-sided heart failure, frequent lung infections. Prevention. The best way to prevent emphysema is to avoid smoking and limit exposure to lung irritants. Using protective equipment in hazardous workplaces, maintaining good indoor air quality, and regular health check-ups are also important preventative measures. Conclusion. Emphysema is a chronic, debilitating disease that significantly affects breathing and overall quality of life. Though incurable, early diagnosis and proper management can slow its progression and help patients live more comfortably. With smoking cessation, medication, therapy, and lifestyle modifications, individuals with emphysema can experience relief from symptoms and improve daily functioning. Ongoing research continues to seek better treatments and interventions for this serious lung condition.
Thank you for watching. Please subscribe our channel.